In Good Shape, your weekly dose of health information on DWTV. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition and beauty. Medical professionals, therapists, and counselors are in our studio every week to offer their expert advice on In Good Shape.
And my guest in the studio today helps patients to get rid of their bad breath, dentist Aviva Grinfeld from Berlin. Thank you very much for joining us.
Thank you.
Dr. Grinfeld, is there a test you can do yourself to find out whether you have bad breath or not?
Well, if there's absolutely no way you can ask somebody, then there is a test. You can take a big, clean plastic bag and breathe into the bag. Close it tightly. You have to get a little bit of fresh air or smell coffee beans. And then try smelling the stuff that comes out of the bag. But it's actually much, much easier to ask somebody and much more reliable to ask somebody. Yeah.
Easier, but maybe more embarrassing.
Definitely more embarrassing, yes.
Why is it so hard to smell your own breath?
Well, first of all, when we talk and when we breathe, the air doesn't enter our nose. It goes the other direction. And we also adapt very easily to our olfactory sense. You wouldn't be able to know after about 5 minutes. If you're in a perfume store, you would, after 5 minutes, not even feel you're in there because you've adapted so quickly to the smell.
So you've adapted to your own breath, basically, so you can't smell it?
Basically. But the other person can. The other person can.
You specialize in treating or in helping patients with bad breath. What, from your experience, is the most common cause?
The most common cause is bacteria in your oral cavity. A lot of patients tend to think that it has something to do with your stomach or your GI tract, and that's completely wrong. It's something that people think, but there's absolutely no scientific basis to it. So it's important to know that it's bacteria. It's bacteria in your mouth. They generally sit in the tongue, especially if your tongue is coated. You'll have a lot of bacteria underneath the tongue. You could have gingivitis, which is inflammation of the gums, or even more severe periodontal disease. And if you have periodontal disease, you have deep pockets, and bacteria basically have a party there all day long and produce gases which smell, and that causes bad breath. So these bacteria produce gases, and they sit in the mouth, so it's very unlikely that it's got something to do with the stomach. Is that right? Very, very unlikely. Less than 1% of the causes are related to any kind of GI or stomach problems. Very, very rarely, yes. We've had a viewer writing to us on that subject. John George from Dubai is asking, can bad breath actually be a warning signal for something more serious, like a stomach disease? It could, but it's not very likely. If you have bad breath, then it's a warning signal there's something wrong in your oral cavity. You just have too much bacteria. The ecology is off. You basically have too much bad bacteria and not enough of the good ones. So if you have bad breath, you really should see a dentist because he or she is the person to help you. There are some very rare cases where bad breath or a specific type of odor can be related to undiagnosed diabetes or something like liver failure or renal failure, but it's very, very unlikely. It's something usually in your oral cavity. Yeah. All right, so if it's in your mouth, you should be able to get rid of it pretty easily, one would think. What sort of lifestyle changes can you make to try and get rid of bad breath? Well, you should do what we all kind of know. What needs to be done is that you should brush your teeth twice a day. You should definitely use some kind of dental floss or some type of brush to clean the crevices between the teeth. And most importantly, you should clean your tongue with a tongue cleaner and a special gel. And very few people do this. Most people who come to see me in my office, they brush their teeth 3 to 4 to 5 times a day. And it doesn't help them get rid of their bad breath because they don't clean the coating on the tongue. Once you start cleaning the coating on the tongue, you get rid of your bad breath very quickly. All right, so it's the tongue. Can you use your toothbrush to clean the tongue? You should not use your toothbrush because generally toothbrushes are too high. You cannot reach the back part of your tongue. There are many, many tongue cleaners out there. There are special gels, and they're very shallow. You can actually clean the back of your tongue much, much more effectively. And most bacteria on the tongue are actually in the back of the tongue. I see. Okay. What about mouthwashes and chewing gum? Does that help? The mouthwash is going to be, if it's antibacterial, it's going to help you somewhat. You know, anything you do will help somewhat, but it doesn't actually reduce the bacteria to such a degree where you get rid of your bad breath. Because if you have, let's say you have tongue coating and you rinse with something, it doesn't remove the coating. You actually have to remove it mechanically. And chewing gum is okay because it helps your salivary glands produce saliva, which is good because you do want to have a wet oral cavity, but it doesn't actually kill the bacteria that cause bad breath.
All right, so you do these lifestyle changes, you see a dentist, and you should be able to get rid of it, right?
Yep.
Well, thank you very much for that. Thanks for being our guest today.
Thank you.